Tony, I'm going to have you just rotate so that you're sitting on the side of the table. So typically you've already gone through your, hopefully you've already gone through and identified like the segment. I rarely do it in sitting. Sometimes I just feel it out based off like where their chief complaint is, or I'll put them down prone and go through my PA assessment and get a better identification of like, one, the location, two, whether it's more of like a spinal versus a costovertebral kind of location of pain or origin. We're going to defer to your other training as well as the thoracic lecture and examination for that. Tony, I guess it's worth noting, do you have any specific areas of pain or dysfunction in your upper thoracic spine? No. Okay. So then we'll just go, just below, T2 or so, and hit more on the flat portion of your spine. So I'm going to have you go ahead and turn over onto your back and lie on your back. I don't like the contour and kind of I call it the topography of this portion of the table, so I use the flat segment. I also like, I'm kind of particular about the table, like where on the table and the table that I use, because some of them have they rat. I want it to be stiff. So I want him to be on the flat portion, but if I bring him down a little bit lower on the table, then there's a little less of a bounce down here. You can kind of feel the difference and hear the difference. The second thing is I'm going to have you scooch over to so I kind of want his torso to touch my leg. Yep, just like that. I also like to split the legs, meaning one leg goes up, one leg goes down. That's for two reasons. One is this leg's going to be able to help me to roll his torso over, and it just is easier from a leveraging standpoint when they're like that. The second is it adds a little bit of an obliquity to their pelvis, which then I feel like translates up the torso and into the rib cage, giving me a better propensity to get a little bit of a gapping as they go into a slight side bend position. Handholds are variable, right? And I know we've already discussed today about whether people like to hold something in their fist or otherwise. I've gotten chastised before because I do tend to gravitate more to kind of a closed fist with a little bit more of a firm something or other. In this case, just a pillowcase between my finger grip. You can also use a pistol. You can also use kind of a cupped hand where their spinous process sits within the thenar and the hypothenar eminence. So in this case, I'm going to use the towel grip. It's just going to look like this. And then I'm going to kind of pull on the back side. I'm going to kind of pull down, which is going to prop his elbows kind of up. And then I'll step up to his elbows rather than pulling them down. That kind of pulls him into extension. And then I also like to take up the slack, some more than others, based off, how much bulk that they have within their upper body. Yeah. So what you want to avoid is any W where they're not really tight, right? So this resembles more of a W than it does like a V. You kind of want the V, where their elbows are stacked on top of one another. And then I also, sorry Tony, I'm going to move this up into your grill a little bit, and I'm going to have you turn away from me with your neck. Yep, is that okay? Yep. I'm just looking at you. Actually turn towards me. Yeah, I think that's better. Yep. So that's going to also create, his cervical rotation will also create tension on the upper thoracic spine. I also provide preliminary bumps just so they know what to expect. So Tony, I just want to make sure this pressure feels okay for you. So it's going to feel like that. Right? You kind of maybe pop your elbow there. Sorry for that, dude. And then, hand placement is going to be like this. If this is my target segment, I'm going to start up a little bit higher and then pull down to it. Alright, and then Tony, as I requested, I'm gonna have you use your right leg to kind of roll over. Okay, so I'm gonna palpate, got the spinous process. I'm gonna reach my hand to stratify that. And then I'm not gonna pull down, I'm gonna step up. I'm gonna add a little bit of a torsion. Big breath in, big breath out. You kind of went on the exhale, but got a couple more.
Yep.
Nice.